AI is not going to replace the doctor per se, but AI, I think, is going to help doctors access information much faster. There's an app called Aadi, which our doctors use. It's cutting out the requirement of the doctor visiting every physical area of the hospital. Now, one of the things that most people think is, oh, you bring in technology, you will cut down your manpower cost. And she said to me, if I have to drive 2.5 hours one way to see the doctor and drive back 2.5 hours, then that itself is going to give me a bigger migraine than the migraine you're going to treat me. Right? Today, we have kiosks for self-registration. We have an application for patients to self-admit, as in they can do a admission process remotely. It's all happening on an automated basis.
You would know how a cafe works. You would probably know how a cloud kitchen would work. But do you know how a state-of-the-art, busy, dynamic hospital works? No, you don't. Today we have someone who specializes into this, who takes care of a big healthcare chain across India. We welcome Dr. Nitin Manjunath to the Healthcare of the Clock. Hi, sir.
Hi, Mukul.
Sir, hospitals are an essential part of an economy. And not only economy, it is essential for well-being of the population as well. So today I want to burst the myths of the people around how a hospital works, what goes behind making, the healthcare facilities that good, and how do you provide that best, excellent patient experience to the incoming patients. So we'll start with, knowing about the paradigm changes that you have experienced throughout your 2 decades of career. So you've seen a lot of changes across healthcare. How do you compare the hospitals of yesteryear and hospitals of now?
2 decades, you're making me feel old. It's been, it's very different. Obviously, you'll see different various levels of healthcare facilities in the country. And you don't have to look back and think what it was like 20 years ago. Because there are a lot of hospitals, a lot of healthcare facilities in the country today, which are still stuck in maybe even 30, 40 years ago. And those are the healthcare facilities that are still catering to a population on a very reactive basis. I'm a doctor, I'm having a patient come to me, I treat that patient, I send them home. That's it. There is no other element to taking care of that patient or no other element of providing care to the society, because that hospital or that clinic or that healthcare facility in that particular location is catering to just that. It is there for a sole purpose of treating the ill. I think the change that we see is more and more hospitals today are moving towards being more predictive, creating an environment where you're able to analyze a patient's behavior, you're able to analyze a patient's outcome, and try to modify that for the next patient that comes in. And all of that is dependent on the fact that there's a lot of data available today. And using data, using technology, using IT, that is what has changed what healthcare facilities are doing today. And that's going to continue to evolve. So you don't have to actually look back 20 years. You do still find a lot of hospitals which are still stuck in that yesteryear kind of operating. And thankfully, we are seeing other facilities that are moving forward and using a lot of information that's available out there to make changes and deliver better care.
Sir, I've worked with a lot of organizations. I've worked with the banks and I've worked with an AI startup. And I've seen whenever new technologies are introduced, there is some sort of resistance. So there's a parallel to ERP system in healthcare, which is called Electronic Health Records, EHR or EMR, as we call it. So what has been your experience while implementing, I would say, one of the best EMRs available in India into NH facilities?
You've worked in various sectors, right? You must have been in a position where you're doing something, you know your job, you know what you're supposed to deliver, and suddenly they bring in this consultant, and the consultant is now telling you, this is what you have to do, this is how you have to do it, change this particular thing. And you'll sit there and think, why is he teaching me how to do my job differently? I know how to do my job. Now put yourself in the shoes of a doctor or a nurse whose main motive is treating a patient, getting that patient better, and making society better at large. And here comes management and says, no, you have to do it on a laptop or on a computer or on a mobile phone or something like that and say, no, you have to do this differently, you have to do that differently. They are the experts in their field. And to get them to change the way they deliver the care that they do so well is a huge challenge. And I think across the world, and it's not unique to India, I think across the world, across all hospitals, today the challenge is in deploying an electronic medical record system. And even if they've deployed it, to transition to a more advanced system, I think that's a huge challenge. And the challenge is usually process-oriented and person-oriented. And that's, I think, the biggest challenge that we've faced.
So I would understand that adoption might be an issue because doctors are busy, nurses are busy, and so is the admin staff. So how do you deal with that? How do you go about, getting a huge product adoption, or I would say an implementation of a new system in your healthcare facility?
Now, if we have to implement something, if we have to change a particular person's way of doing work, then you have to ensure that that digitization of that process is not only just going to be a replica of the paper-based or the manual process that we already had, but it's actually going to make it more efficient or change it up a little bit so that it benefits everybody on whole. So the first thing I think is to ensure that the process, the digital process that you're trying to implement, changes the manual process that's in place by making it more efficient, cuts down on the time, and provides a feedback loop to the user that makes it easier for them to do the process again in the next iteration. That's one part of it. The other side of it is to ensure that when the product is being developed itself, engage with the end user. At the time of the UATs, engage with the end users, understand what their problems are and how you can make that process better so that they feel that they are co-owners in the entire product and not just somebody who's now taking a product and implementing it on the ground. They feel that they own the product as well. And so I think that those two things have gone a long way, at least for us, in our journey of implementation of our Atma system. And every new iteration of the system that's coming through, every new feature that's coming through is run through rigorously with doctors, nurses, administrative personnel, paramedics, all of them, so they know exactly what is to be expected and how that's going to make it better for them.
So you spoke about a lot of mobile apps and introducing mobile solutions even for patients. The only apps that I know are the apps via which I order my medicines, Max, or book tests. That's the only apps that I know. So can you tell me what all mobile solutions or mobile apps you are using at NH facilities?
Mobile apps are like, I like the new age Sanjeevani for a lot of our problems in the hospital. I think the most widely downloaded one of our apps is the patient app. I think about almost close to 1.52 million downloads of the NH Care patient app. And it's highly regarded as well. I mean, on the App Store, at least the last time I checked, it was somewhere around 4.6 or 4.8 star rating. So we're glad that the patients like it. So this app particularly provides an interface for the patients with the hospital without actually have to come to the hospital. They're able to look at their reports, they're able to access their prescriptions, their doctor's notes, they're able to book tests, they're able to book appointments, and also conduct video consultations or have video consultations on this app. And more features are coming into it. Yeah. But essentially, it is negating the requirement of a patient to visit the hospital physically. And I think that's a phenomenal app that's worked for us. The other apps that we've got, there's an app called Aadi, which our doctors use. Now again, it's cutting out the requirement of the doctor visiting every physical area of the hospital just to access some information. So previously, if the doctor needed to see the lab reports of one of the patients in the ICU, he had to either give a call to the nurse there and say, what are these reports? And that has a lot of, there's a possibility that the nurse picked up the wrong file because there were two patients with the same name and gave him the wrong report. Or rather, it takes time, it's taking the nurse away from what she's supposed to be doing. Or the doctor had to go physically to the lab, to the bedside and pass through the file and look for those reports. But now this app on Aadi has created a platform for doctors to access all the information about those patients on their mobile phone. And it's not just an app to access the information, but it's also an app to communicate with their peers. So they're able to communicate with their colleagues in terms of, let's say there's a patient with a complex multi-organ dysfunction, and there's a nephrologist who has to communicate with, let's say, the intensivist or the pulmonologist. They're able to do it on the app. So you're able to conduct digital multidisciplinary team meetings. You're able to order for tests, review reports, order prescriptions, and also even type out and discharge a patient on the mobile app. So a third app that has been introduced in our hospitals is an app called Nama. Nama is an app that has been introduced purely for the nurses. Because if you look at what the nurse does, and you take this feedback from any nurse across the country, across the world, if you ask them, what would you like to do differently? Their feedback would be, I want to spend more time on the, on the bedside of the patient and less time in documentation and paperwork and all those things. That documentation is important. That's why we have them do it. But it's such a tedious process to document so many things on a daily basis that it's actually taking the nurse away from the bedside and delivering the care that they're supposed to. So what Nama does is it simplifies a lot of that documentation. It makes it very easy for them to do it. So something that would take them 15, 20 minutes per patient earlier now takes them a couple of, maybe 2 or 3 minutes on the app to fill out the required necessary documentation. And also, that's again a communication platform for them as well, that anything that the doctors have ordered or the doctors have advised on Aadi or Atma features on their Nama app. So again, that information disconnect that is there between the doctors and the nurses has been taken out, because you've got a very smooth, seamless communication platform where they're able to do a lot of documentation as well. And it's also made it very easy for handovers, because you have nurses work in shifts, right? So they have to come in for a morning, evening, night shift. And between shifts, there's a handover that happens. And that's a very, very, very time-taking, painful process where they have to hand over every patient, and it takes a lot of effort. But Nama has made it a lot easier for them to hand over those patients to the next caregiver that's coming in the next shift.
So I would also like to tell about my interpretation, like from a commoner's point of view. Once my father was in an ICU, right? So I used to go to meet him, and I could only track the doctor for once, right? And he used to write some medicine, and then he used to go. I never used to interact with him, and I never got to know what those medicines were for. And you are always anxious, okay, whether the right medication is being given, because if it doesn't work today, then again it will be like a 24-hour break, and the doctor would come again. But I think with Aadi, all that are a thing of past now. Yeah, because the progress happens rapidly. You change the medications, you do the rounds online. I think that is what made the real difference. Yes. And I'm pretty sure that it has also reduced the average length of stay of a patient within the hospital.
So there's multiple facets to what Aadi is doing, right? So Aadi, one, like I said, it's a communication platform, and it's not just a communication platform between the doctors. This is a feature where a patient communication can also happen, where within the app itself, doctors are able to post messages or pictures or any other information that they want, which goes straight to the patient family as well. Okay. So it's a phenomenal communication tool in terms of making sure that real-time communication or real-time information is going to the loved ones of every patient. The other thing is, because a lot of the lab reports, the prescriptions, all of that is done on a mobile. The doctor can be anywhere in the hospital, and they're able to review those reports sitting where they are, which means that decision making is a lot faster now. And also they're able, and there's somebody else who is at the bedside, maybe the nurse or maybe the duty doctors who are in the ICUs or in the wards, or the residents. They acknowledge receipt of any orders. So that acknowledgement also gives a lot of satisfaction to the doctors, knowing that, okay, this is what I had changed, and this has been acknowledged and it's been put in force. So that means that those changes are going to make it faster for care delivery and potentially reduce the length of stay of every patient.
So we have spoken a lot about the processes, introduction of new applications, new solutions. But at the core of it are always people. People that are going through this, who are using them, or experimenting with it. So how do you ensure that they are well trained and they are up to date with all the advancement that is happening in the healthcare? I understand doctors have their own CMEs, they have a lot of workshops, they have a lot of sessions, and plus academia is also there for them. But what's in it for the staff like nurse, admin, and other people?
Thankfully, we've not had too much of an issue in that because the platform itself has been built with a lot of feedback from these users. So for them, it's very intuitive that, okay, this is how it works, or this is what it's supposed to do. There's a lot of self-training that's possible because it's a fairly straightforward, simple system. It's not a very complex, though the back-end architecture might be extremely complex, but that's what makes the front-end interface so simple for patients, for the users. And the important thing is also understanding user behavior. So if there is something, like I'll give you an example. I use my phone every day. I know exactly which page to go to turn on a particular music app, or where my photo app or camera is. Now, if I hand you my phone and say, can you take a picture of me? It'll take you 5 seconds to find the camera app. That's because there's a lack of familiarity. It's not about you not knowing how to use it. It's just that you're not familiar with my particular phone for you to get to that. But when the UI takes that into consideration, that let's bring in a level of familiarity that it looks or feels very similar to other applications that you normally use, then it makes adoption much easier, makes training much simpler. And so if you look at Aadi, for instance, it's almost like a chat platform where you can attach files, you can share documents, or you can access various aspects of it, but very similar to a chat platform that you and I use on a daily basis. So that's important. So that familiarity that the product has brought in for every user makes it much simpler for us to train. And of course, any new employee comes in, or a new nurse or a doctor comes in, we give them that first-hand training at the point of joining. But after that, there's constant interaction between them. We have chat groups where all the doctors or all the nurses are there, where new features with video clips of how those new features are going to impact the way they work. Those things are posted. So there's a continuous learning as well. And we get a lot of feedback from them on these apps as well, on these chat platforms, that we're able to then take back and pass it back to the product development team and say, this is a particular feedback. And so that information movement between the producer and the user is very smooth.
So all of these challenges are more operations based, that I understand, and I also understand that such level of tech would require a lot of investments, and it would require a lot of push from your side, because you want to improve the processes. But is that even paying off? What I want to know is what kind of business impact you have experienced in past 2 to 3 years while you have incorporated these innovative solutions into the mainstream hospital working.
From a purely a financial standpoint, we've seen this payback in multiples, right? Whatever investments we've had to put in for these IT platforms, whether it's the hardware, the software, the training, the resources, it's definitely paid back in multiples from a revenue or a financial standpoint. But what it also does is it reduces so much waste in the system that we actually retrospectively don't even know how to quantify, because it's become so complex complexly embedded within our system that I can't even go back and say, this is how much money I saved because of this particular implementation. And that's going to, exponentially keep growing. Now, one of the things that most people think is, you bring in technology and you will cut down your manpower cost. You will cut down your number of people that are working in billing or in the lab or anything like that. And I think the way we look at it is, it's not that it's going to reduce the number of people that we have, but rather it's going to, see, as an organization, we have to keep growing. Yeah. The growth versus the growth in those resources is disproportionate. So technology unlocks that potential to say, I'm able to scale up at a much higher proportion with the same resources than it would have been possible without the technology. And it's not like after implementation of all of these IT platforms and the tech platforms, we've reduced the number of people. No, in fact, on the contrary, we've increased the number of resources that we have at the hospital, but our throughput is disproportionately higher than what it would have been without the tech platforms.
So we have done a bit of research about NH financials because we wanted to understand, when it's a very tech-driven organization, how does the impact is. So what we have realized through our research is Narayana Health has kind of doubled its revenue in past 3 years, and that 35% increase from the revenue in 2022 to 2024. So that's commendable, sir.
Yeah. So that's, like I said, from a revenue or a financial standpoint, it's paid back in multiples. Whatever investments have gone in, it's paid back in multiples. The part that I'm not able to quantify is how much of the waste reduction we've been able to do. And that, if we have to add that into sort of the financial benefit, I think it's going to be much more than the doubling that we've seen over the last
couple of years. Yeah, it is in fact how I would call it. So while you have impacted the business of NH with these interventions, but at the same time, the patient sitting at home, getting their online consultations through the NH Care app, getting the bookings done, and that's all their lab intervention, so that they don't have to come back again. I think it's add much more to just those numbers.
Exactly. So if there's, let's say, again, there was an instance where there was a lady who lives in North Bangalore, right? We are in the extreme side of the south side of Bangalore. And for her to come, knowing Bangalore traffic, for her to come from North Bangalore to come and see a doctor with us, she might as well have driven to Hyderabad and gotten a treatment done. So she has been a patient with us for many years now. But these applications have now given her ready access to our doctors, where, I mean, she has a recurring migraine, and that's the treatment that she's been undergoing. And she said to me, if I have to drive 2.5 hours one way to see the doctor, get a prescription, and drive back 2.5 hours, then that itself is going to give me a bigger migraine than the migraine you're going to treat me with, right? So this particular app and this NH Care and Aadi and all of the tech interfaces that we've been able to create between the patient and the doctor has ensured that she has remained a patient of NH. Because it wouldn't have been too long for her to have switched doctors or switched hospitals. And so we don't know how many such patients we've been able to retain just because they have all of these applications available to them today.
So you spent a substantial amount in the US as well. So how it was implementation of solutions there as compared to India?
I think the healthcare systems itself are so different between the US and India that in the US it's a very documentation-centric, insurance-centric kind of an ecosystem, whereas here it's more patient-doctor, patient-hospital centric sort of an approach. So when you look at implementation of it, I was part of, at least for a period of my time there, I was a part of the team that was trying to implement or a transition of an EHR system from one to another. And the entire task was so, how do I say this? It was so difficult. It was so needlessly elaborate. It was so complex. And you start to realize, and I think when I say about the feedback during UATs, you start to realize the number of hurdles that you can face in terms of implementation if you've not taken into account what the end user is actually looking for, right? If that person is not, if you're not making that person's job easier by implementing this, then there is no point in implementing it. And that's the challenge that I at least could perceive during that particular exercise that we took up. So I was a part of the team that was trying to implement it for about 8 months. And then I think they took another year and a half after I was done to actually completely implement it. And whereas for us to have transitioned from whatever system we were using, the manual IT and other systems we were using, to Atma, to my recollection, it didn't take more than 4 months. We were able to completely and let go of whatever we were doing and transition onto Atma in a matter of about 3 to 4 months. And every new feature that's coming in as well, every new thing that's coming in as well is so accelerated because I think the feedback of the end user is so fluid to the product team that I think our production team is our honorary doctors themselves, because they've now understood what happens in the hospital so well that they themselves have sort of an advanced understanding of hospital operations and clinical medicine. And that's sort of, I think that's the biggest difference that I've perceived, that those systems in the US are maybe big names, maybe huge, companies, but implementation is a nightmare compared to what we've been able to achieve here.
So 3 to 4 years back, we experienced a situation like never before, the COVID outbreak. So how did you ensure that the facilities, all the Narayana Health facilities, stay agile, flexible in such circumstances?
One, I think information is key. Communication and information to everybody involved is the primary thing. So if you have a system where it's very opaque and people don't know what's happening, people don't know what to do, then you're going to have a very difficult time in being able to remain agile. Second is there needs to be a sense of ownership amongst everyone. The only way to do that is to make them feel a part of the process. They have to feel that they are contributing rather than just doing what they are told to do. And so that feedback loop between administrators, doctors, nurses, empowering them to make decisions and suggest changes or suggest different ways of doing things goes a long way. And then for us to make it easier for them to deliver the work, the care that they have to, making sure it's a safe environment for them to work in, and make it sort of to break those barriers between the physical and the sort of social barriers between them to be able to interact and make quicker decisions and provide better care. So I think the video consultation aspect of the Aadi app and our Atma systems it was sort of in fast track mode. The implementation was in fast track mode during that period, and that helped doctors not only stay in touch with their patients who today are not able to come to the hospital because of COVID or because of the lockdowns and other things. They were able to continue to provide care to those patients, but also it created platforms for us where a patient who is admitted in the ICU, in a COVID ICU, is able to communicate with their family members at home. Yeah. And that information, that communication is a big part of ensuring that you're able to make lives better.
So we have a lot of buzz going around smart homes, smart cars. I mean, everything is going smart. How close are we to a truly smart hospital? And if we are not, then what we should be doing to make it smart?
We're closer than people realize. And we're moving towards a system of self-automated processes, which just leverages the ability of the patient to take decisions for themselves. So today we have kiosks for self-registration. We have an application for patients to self-admit, as in they can do a admission process remotely. We're able to block a bed for them, and they're able to provide the documentation for admissions and other things. And it's all happening on an automated basis. We have automated labs. We have automated, diagnostic systems. And so when I say a smart hospital, it means being able to leverage every aspect or every interaction between a patient, a healthcare worker, and an administrator on a digital platform. And we are much closer than people think. I think the only hindrance to this entire process of becoming a truly smart hospital, the only hindrance is the fact that people don't know that we're already so close to it. I think if people knew that we're so close to it and people were going to embrace every aspect of the healthcare ecosystem, embraces the fact that this is what's going to happen, we'll get there much faster.
So, you've been managing facilities, taking almost, in every month, or probably I would say in every specific period of time, you're taking it a notch above. So, how do you envision a hospital of 2050?
I think the hospital of 2050 is not going to be a physical structure. I think healthcare is going to go more and more remote. We're going to be able to deliver care to people in their homes. We're going to be able to do a lot of things remotely that today we're not able to. So when you look at a hospital per se, it's going to be a structure which is catering to the sickest of sick patients and patients who require some sort of a surgical intervention, and that too only for the surgery. In the Western world today, we already have systems where patients who come in and have a knee replacement, for instance. Knee replacements happen in ambulatory care centers. They're called ACSs, and that means it's a center that works from morning to evening. They literally shut down everything, turn off the lights, lock the door, and walk out at night. Okay. Which is only possible because the delivery aspect of what they do is taken to the home. So a patient who's undergone a knee replacement needs painkillers, they require pain management, they require nursing services. All of that is possible at home as well. And India is getting there too. So once we get to that sort of a situation, a hospital will not be these big, giant buildings with OPDs and wards and ICUs and OTs and other things. I think there will be more consolidated systems where you have very sick patients going and getting admitted, and everything else is done remotely or on mobile phones or on an apps or things like that.
So, a little controversial question. So, AI is almost everywhere. People talk about, that AI will replace these many jobs in a certain sector, these many jobs in IT or content creation. Now we have ChatGPT. In any which way, will AI ever be able to replace a doctor?
I don't think that's ever going to be possible. The reason is, at least my belief, is that what does AI depend on? AI depends on a plethora of information that's available out there, and it's able to consolidate that and give you a quick result, a quick response based on all the information which is out there about a particular disease or a particular condition. How did that information get there in the first place?
Yeah.
Somebody put it there. And that's
data,
a human being.
A
human being has worked to put that information out there, and AI has just leveraged that information. Now, if you look at what's happening with health, the health of the country today, or you and I, our health issues today are very different from the health issues of our grandparents.
Oh, yeah.
What they had
exactly.
a couple of years, decades, many years ago. So that's going to constantly change as well. Which means the information which is out there is going to start to become redundant over a period of time. And somebody has to put in that work to make that information relevant, which AI is now going to harness and provide. So AI is not going to replace the doctor per se, but AI, I think, is going to help doctors access information much faster and help them make decisions much better. But you will never, at least I don't believe we will ever have a, a, a virtual doctor who you will trust and say, yes, I'll go by what that advice is from that, because that information has to come from somewhere, and human beings are the ones that have to put that there.
Now coming on to the lighter aspects of hospitals. So nowadays we see a lot of hospitals, being compared to the 5 stars. And I'm not going into much depth, but 5 stars have their own processes, hospitals have their own processes. So if you were to implement one feature from a 5-star hospital to the NH facilities, what will that be?
I think 5-star hotels have really nailed the consumer experience part of delivering their services. I would like for hospitals also to be able to achieve that sort of a personalization. That if today there's a patient coming in, if we know that this is a patient who is, let's say, elderly, before the patient reaches the hospital, if I can have a wheelchair waiting for them to assist them, or a general duty assistant available for them to help them through the entire process. If we feel that this is a patient who is diabetic, needs to take medications at particular times of the day, ensuring that those processes that they have to go through within the hospital are taken care in such a way that they're able to take their medications also at the right time. That user centricity, consumer centricity, is something that's lacking in most hospitals today. And while we get better at it, I think 5-star hotels are sort of the North Star for us in terms of consumer experience. And I would really like to see hospitals getting there as well.
So, what I've observed through our conversation, there has been a lot of room of experimentation for you while at NH and while at your previous organizations. So, what's that one most unconventional idea which you even hesitated before even implementing or putting it across to the higher management?
There was one particular instance where we were looking at clinical data, and we were trying to find out, and this was before we implemented all of these things, we were trying to see what our antibiotic usage in the hospitals, was. And because we were paper-based, there was no way for us to know how much of what antibiotic is being used where. And we were very surprised. And if you ask anybody and you ask, where do you think antibiotic usage is highest? They will say your medical ICUs, you will say the pre-operative area where you have to give a pre-op dose of an antibiotic or something like that. To our surprise, we found that the antibiotic usage was highest in those private platinum rooms. And that's because that's where the people with a lot of money, very important VIPs are coming. And so there's very defensive medicine being practiced there. And that's very subconscious. And it's not something that doctors do willingly. They don't say, oh, no, this patient is there, so I'm going to give more antibiotics. But subconsciously, the system has worked in such a way that the people in the private rooms are getting more antibiotics than somebody in a ward or an ICU. And all we needed to do is go back to the doctors and just show them that information. And they were taken aback that this is how, and it's not a single person or a single individual who's doing that. That's where we felt that clinical analytics, clinical data is extremely important to be given back to doctors for them to make better clinical decisions. And this was many years ago. This was several years ago. But then I think today where NH is and what I see in terms of implementation of clinical analytics, I think we're in a far more advanced state than we were back, than it was what I'd been exposed to during that period.
Yeah. So that's a great conversation. With this, we conclude this episode of Healthcare Off the Clock. And thanks a lot, sir. Hope you all have enjoyed the conversation and insights which sir has provided and deep dive into the different aspects of the healthcare facilities. Thanks a lot, sir.
Thanks, Mukul. Please like, share and subscribe to Healthcare Off the Clock.